Paragamian, CEO of Health Monitor Network, and I'm joined today by Dr. Julius Wilder from Duke University, a gastroenterologist, a professor of medicine, and you've been the chair of the Diversity, Equity, and Inclusion Committee at Duke University School of Medicine. So anxious to get into some conversation. Thank you for being with us today.
Yeah, no, happy to be here and excited about our conversation today.
So at the highest level, the whole topic of health equity, health literacy, certainly has been very prominent of late, but I know that that's something that has been a passion of yours for a long period of time. As you track that arc of progress, what gets you excited about where we are now in that journey?
Yeah, you know, you highlighted that some of us have been doing this work for a while. This idea of knowing the importance of how we frame issues around health and how we bring them to the community to ensure that they understand and are engaged is not necessarily a new thing. But what really excites me is the point you just made. It really has become something that is a point of emphasis now in a way that it was not before for various health systems and health entities that are interested in engaging and improving health outcomes. And I think the more engaged these entities become, the better outcomes we're going to see because of the improved health information we're going to be providing our communities.
Right. And you touched on health information, which certainly is the reason that we as a company wanted to connect into this. And as you know, and for the audience, we as a company made a contribution on a 3-year grant so that you could, with your colleagues, study healthcare communications, the different manners, modalities of healthcare communications and how it impacts particularly underserved communities. We're about a year into that 3-year longitudinal study. Tell me a little bit about some of the early things that you've been doing and the things that you're excited about.
Yeah, you know, first of all, I want to say thank you. There are not many people, leaders, people in industry, health entities that are interested in really understanding these issues and are willing to not just talk about it, but actually, you know, let's be real, you know, put money into it. Right? That's how you really know, a person's commitment, a company's commitment, and I actually really commend you all and thank you for that.
Our pleasure.
And it's important that you understand that there's already been tremendous benefit, certainly within our community, because of the contributions you guys have made to this work. You know, we're really excited. We have really looked at a number of different spaces around how to improve health literacy, with a real emphasis on leveraging that to improve health equity outcomes. And so there are, for example, a large organization here in the Durham area that focuses on care in Latinx communities. And with these resources, we were able to help organize their various community engagement and health literacy events and ensuring that they actually have proper translation, right? So simple things like that, you know, and it seems like something that's common sense, but if you don't have the resources and the expertise, you know, you really are not prepared to provide these entities, these communities, what they need. And so we're really excited about that potential project and what it's meant to that community. Another great example of the work that we've done is understanding that, you know, there are a lot of food deserts. We know the importance of healthy diets and how that can drive a lot of, unfortunately, you know, adverse health outcomes. And so we actually were able to engage in nutritionists and actually now in 2 separate large community-wide events, invite community members in, provide them healthy eating options where the nutritionist actually cooks food for them. She teaches them about how to cook in a very healthy way, meals that were very heavy in terms of vegetables and fruit. There's just some tofu there, which, I'm all about the meat, but there was some tofu that was pretty good. And again, just an opportunity for the community in their space and in a way that is engaged and in a way that they can understand and really connect. We're able to learn about how to eat better and live better. And then when you think about what's happening in those 2 spaces, you're talking about things that are not like one-time things, but those are the kind of things that you can do in a community that can have a lasting impact. You know, how they eat is not just going to impact their diabetes right there in that moment, but will have an impact on their diabetes, their high blood pressure, you know, their cholesterol moving forward in numerous ways and for a prolonged period of time. And so those kind of sort of projects have been really, really great. But I'll say we're also excited about going the other direction as we've looked at what can we do for providers so that we learn more about health literacy, so that we as providers in our day-to-day engagement with our patients, how can we do a better job? And we actually now are looking at a series we're going to provide for our GI division, where we focus on health literacy and health equity and begin to engage us to help us understand more about these issues and take better care of our entire community.